Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, I have two guests, Marina and Eugene Borukhovich. Marina and Eugene are the dynamic duo building what they call the health coaching revolution through their health and wellness coaching platform, Your Coach Health. They are seeking to make coaching more accessible while enabling a global gig economy of health coaches. Marina is a mission-driven serial entrepreneur and cancer survivor. She's the founder and CEO of Your Coach Health. And Eugene is a serial entrepreneur, executive, builder, speaker, advisor with a focus in digital health. He's the co-founder and COO at yourcoach.health. Eugene's previous history includes heading up Bayer's digital health unit, running a healthcare consulting practice, and other work in the sector over time. Welcome, Eugene. Welcome, Marina. It's a pleasure to speak with you today.
Thank you, David. Wonderful to speak to you, and happy to be here.
And David, it's great to reconnect. And I think we just realized this is my second appearing on your amazing show. So happy to be back.
Well, okay. Not many would subject themselves to a second round, but you're a brave man. So thanks for being here. I gave a thumbnail sketch introduction to Your Coach, and I wonder if you can expand on that. Let us know what you're about, what you're trying to build here.
I would love to do that. So Your Coach came about very organically. Like you mentioned, I am a cancer survivor, and through my cancer journey, after the doctors were done with chemo and radiation and surgery and reconstructive surgeries, I was left very broken and discovered health coaching and a process of hacking away at my own body and realizing what it means to be holistically healthy. So I became a health coach, started coaching my own clients, realized that there was no, quote unquote, sexy enough solution out there to manage my own clients, and created Your Coach Health, which was supposed to be just my business. And it was supposed to be this little toy to help me manage a few of my clients that I had. Fast forward to today, we have 2,700 plus coaches on the platform who are using it. And at the heart of what we do is still this practice management platform for health and wellness coaches, where they can come in and manage their whole business, from onboarding clients to setting tasks and to-dos, video sessions, chats, notes for afterwards. And obviously, we can't do anything on a small scale. And we quickly realized that what these coaches are great at is coaching. And not all of them, but obviously the ones who are validated by us on a platform, they're not maybe so great at marketing themselves. So we bring them new client opportunities. For those coaches that we validate through the platform, we give them new opportunities with our clients who are companies looking to surround their service or product with health coaching.
And David, I'm just going to add, as Marina pointed out, right, she was building this, again, started as a toy to a certain extent, and to manage her own business, to optimize it. And, part of, as you did kind of the introduction, I'm in and out of large companies. And as I joke around, I'm either recovering executive or recovering entrepreneur. So I'm still recovering from my last life sciences organization, which was a fun journey, but there could be nothing better to join Marina on that journey and get back into the startup world and really make a difference in the impact. Things that, I guess more holistic in a way versus just pinpointed to a particular disease.
So when you say holistic and you're talking about sort of a broad approach to health coaching, I guess the thing that I wanted to probe a little bit on is sort of how the coaching platform and the coaching service integrates with the broader healthcare ecosystem. It sounds like you were talking about, or starting to talk about, Marina, how you integrate with other services. And I wasn't sure if you're referring to integration into a broader benefit package from the employer side, or if you're also integrating into the healthcare industrial complex?
Yeah, would love to expand on that. So before we go further, maybe I should define what a health coach is for those who are maybe not familiar with the term,
Right.
and also because that term has been thrown around so much, and it means different things to different people. But a health coach is a partner or mentor that helps individuals set and achieve their goals. And it's very much driven by the individual, driven by a person. A health coach doesn't prescribe. A health coach elicits that intrinsic motivation within an individual and sets them on the right path to achieve their goals. I know Eugene loves to refer to it as a...
I always jump in because, as joining Marina as a COO and witnessing, what she went through, and especially how health coaching has helped tremendously, I needed to understand really what it is. And so I just took a 9-week kind of extreme coaching class, let's put it that way. And what I kind of summarized it as to the 47 students in that class is non-clinical psychotherapy. And I think as we sort of went deeper into it, a psychotherapist goes deep into your history and into finding the root causes of things, right? Health coaches help there as well, but they're really looking forward, right? And so
it's all about goal setting. Health coaching is about goal setting. And where we fit in, as a company, we need to be laser focused. Obviously, we're a startup. We're a young startup, a little over 2 years old. But what we are doing, we're not going directly to health plans. We're not going directly to employers. We're working with digital health companies, and we surround their product or offer, and we go with them together to sell the service.
And so go ahead, Eugene.
No, I wanted to, as we start sort of kind of setting the scene for health coaching, and, again, healthcare is so based, on reimbursements. Maybe just again for your listeners, a little bit more education around health coaching. It's been anchored in about 20 years of history at this point. Only in about 2012, there was a entity set up called National Board of Health and Wellness Coaching, which actually went deeper into starting to gather the science, the jobs to be done, and became an accreditation body for now almost 110 schools, I believe, and their programs, and also a certification body for health coaching. End of 2019, the National Board, together with the American Medical Association, released 3 test CPT codes. I'm not going to blur out the numbers themselves, but in short, it's initial session, it's ongoing one-on-one session, and group coaching sessions. Those are the 3 CPT codes. That was 2019. In 2021, a taxonomy code for a certified health and wellness coaching has been approved, which means, and again, for many of the listeners will know, a national provider identifier can be obtained by a certified health coach. And then finally, just from a historical perspective, this year, the National Board of Health and Wellness Coaching, together with UC San Diego, began real-world data collection on those CPT codes. So, again, while health coaching, and I kind of joked around early on, some people have a perception of this as I joked around, cuckoo voodoo science. It's been anchored in science. It's 20-year-old industry. And, again, for about 10 years, it's been now established, and there's numerous of studies, which we can get to later.
So there's a pathway to reimbursement here, and maybe in the interim there is private reimbursement available. And you've answered one of my other questions already, which is about sort of validation certification. So there is a framework for the professional certification of the coaches.
Yes. So certifications come in many shapes and sizes for health coaches. There's undergraduate programs of 4 years. There's graduate programs of a couple of years. There's certifications that are 10 months. There's certifications, like Eugene said, 9 weeks, like a program he went to. And with all of those, somebody graduates with a health coach certification and calls themselves a health coach. A certification alone does not make somebody a great health coach. Even if they pass the national board exam, it's yet another certification. So what we do on the platform, we see what the coaches do in the real world. We see if their clients are showing outcomes. We see how incredible these coaches really are. I mean, there's some coaches on a platform. There's one, she has 19 certifications. She never coached a day in her life. So not somebody who would ever match with a client, not somebody who would ever recommend to our clients. So there's a lot to be said about real world experience and real world data as well, in addition to certifications. Just wanted to add that in there.
Sure, understood. It's not just about the certificate. You were talking about integration with digital health offerings, and I'm wondering if you could give one or two concrete examples.
Yeah, so we announced our go-to-market customer, and again, I'll just take 10 seconds. We've very much focused as a company on the supply side of the equation, right? And building the trust in the coaching community, and hence, as Marina mentioned, 2,700 coaches plus. And we just recently announced our go-to-market customer and partner, Twill Therapeutics. aka artist formerly known as Happify, where for the listeners that do know, they're anchored as a digital therapy and digital tools, science-backed, and your coach will be powering up all of their live duet coaching. So we wrap around the digital tools and provide live coaching. The program is public out there. It's a 30-minute voice video session a month with unlimited chat support for the end users of Twill Therapeutics. So this is our go-to-market customer and partner, and unfortunately can't mention others that are in there just yet. But
great, that's a great first step. And so I'm familiar with the name Happify, and I understand there was a transaction or a name change or both. Where do people access Happify? Is that direct to consumer? Is that through a health plan? Is that through an employer?
Yeah, so they have, and I don't want to speak too much, I'll leave it to them.
Sure.
Their customer channels are all of the above, health plans, large employers, as well as life sciences. And so we are partnering up across their book of business and, looking forward to expanding that.
Okay.
And the use cases, again, I'm just going to dive deeper a little bit, maybe. Where our go-to-market are these digital health companies that have made significant entry, and again, very much science-backed. That's our key component to all of this. And the use cases we're seeing is across virtual care. Virtual care companies are surrounding, health coaching around their services. Digital therapeutic companies, aka Twill. Broader digital health, remote patient monitoring. Again, the example that we use, and to be clear, we don't have that as a customer base, but around the goal setting and the use case that I've been using is, God forbid you had a stroke, and upon your recovery, you do have to wear a particular device. I think people have. The whole adherence as a word, I think, people that do know me really do know that I don't enjoy that word. I don't think people want to be told adherent. But if you approach it from the perspective of, well, I had a stroke and I just want to be able to get up from a chair or walk a block, and goal setting, and the overarching goal is to literally being able to get up and walk, then that becomes the short goals as a device monitoring or remote patient monitoring. So that's another use case. We've seen inbound from clinical trials and for caregivers. We've seen inbound from patient support program and surrounding coaches around it. And again, it is around, if you think about any of those use cases, as human beings, we have our goals. And if we don't know them, this is where coaches really help extract those.
If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and I'm speaking today with Marina and Eugene Borukhovich. We're talking about a range of services that include or bump up right against healthcare, and frankly, services that are broader than that are sort of, I would put out there the idea of life coaching in the context of healthcare. And I'm wondering, do you draw a line? Is there a line to be drawn? What are the range of services? We talk about healthcare versus well care. Some of the examples you've been giving are around post-significant encounter with the healthcare system, but I imagine there are also things around lifestyle changes, mindset changes to perhaps prevent those encounters with the healthcare system.
That's exactly what it is. It's about lifestyle and behavior modification. So on the platform, we have life coaches, we have obviously health and wellness coaches, there's trainers, but what we focus on specifically as a company right now is health and wellness coaching. And health coach is a non-clinical profession, so a health coach will never prescribe anything, but they will help an individual set the right goals and help them get to those goals.
So do we have any information out there, research around the ultimate system level value of the wellness coaching, right? At the end of the day, for better, for worse, this is all about dollars and cents. Someone's going to invest and promote the platform and engage with you if it makes sense for their bottom line. So where are we on the path in terms of being able to demonstrate real value there?
There have been numerous studies on health coaching and benefits of health coaches. There is a compendium of health and wellness coaching literature. And from that, it just spans across different categories. In oncology, in heart disease, in obesity, hypertension, diabetes, across all of those categories and more, there have been a lot of studies that have shown improvements in patients.
Yeah, and David, as I think most of the listeners that tune into your show know, the path from the research and some of the clinical trials, and we'll cite, happy to share kind of the link for your listeners to the compendium that the national board, spearheaded. But just to kind of, a lot of the health coaching has been around, let's call it metabolic diseases, diabetes, and hypertension, where we are seeing kind of the next generation is more in the preventative, non-acute mental health, right? And again, just to keep reminding the listeners, health coaching is a non-clinical service. But just to give you an example, out of 12 studies within the heart disease space, 91% of those studies revealed significant improvements in heart health, right? With other positive outcomes, including, improvement of behaviors, better diets, 100% adherence, and I'll use that term for the healthcare audience, to better exercising. So this is just heart disease alone. And then again, happy to share more and the links to the compendium. There is an add-on to the compendium, or let's put it this way, there's been a lot more studies since the pandemic hit as well in health coaching. And again, national board, is leading the way in augmenting that compendium. And we haven't seen kind of the early data, but there are hundreds and hundreds more studies that are coming out. Now, kind of the final piece on this a little bit is for an economic value, we all know that initially it's this research and studies, then it does need to get to some level of reimbursement. The interesting part will be, how does health coaching really place in value-based care? I think that's still TBD from an overall cost perspective. And the economic value, which is exactly why there is now, the real world data gathering is happening to move those things forward.
So I imagine the years that we've been living through with the global pandemic has obviously made remote services more attractive to more people. We've seen a explosion and maybe a retreat from that explosion in traditional, quote unquote, traditional telehealth. But this is part of that trend, I imagine, as well.
Yeah, I mean, look, we officially incorporated as Your Coach Health on January of 2020, right before the pandemic hit. And while, starting a startup right in the midst of the pandemic, always challenging, we did have a lot of the tailwinds because of that. Just like kind of the broader digital health, slash telemedicine did benefit from that in order to provide access to care to the patients and health consumers. That's what ultimately is. So absolutely, I think coaching, if you rewind back, was, meet your coach locally. Yes, there were tools, there still are, to manage that relationship online, but it certainly really pushed it forward in the last 2.5, 3 years.
So in the scheme of things, I'm trying to get a handle or ask you to help us get a fix on where health coaching fits in the healthcare stack, let's say. Is this a tool that, again, in the scheme of things, relatively low cost compared to a course of cancer treatment, compared to lifetime management of a metabolic disease? Do you see the opportunity here as a pivot point, how do we turn the super tanker of healthcare? Is health coaching a means to try to do that, whether in terms of quality, whether in terms of cost, whether in terms of effectiveness, whatever metric you want to think about using here?
Well, we obviously think so. We think that, and a health coach does not replace a healthcare professional. A health coach is an essential part of a health and care team. So doctors have increasingly less time to spend with patients. If they have 5, 10, 15 minutes, it's a good day. Nurses, they're not doing what they're meant to do. Nurses are doing jobs of 5 people, and the price of nursing costs has tripled in the past couple of years. So here come health coaches who are trained in a lot of the same techniques as therapists, such as motivational interviewing, and they're trained to have the time, whether it's 30-minute live session or an hour live session, they're trained and have the time to continue the conversations with patients and clients while keeping in contact with the rest of the health and care team. They keep in contact with doctors and therapists and physical therapists and nurses and dietitians, right? Whoever is part of that team, and working together holistically, again, here's that word, to help an individual become a better version of themselves.
And one, I'm just going to add one little thing, and people get to ask us, what really is a dietitian a health coach? And the way we kind of position this is, you have a health and wellness coaching, let's call it the national board certification, yep. But you can also be a registered dietitian. But a registered dietitian is not necessarily a health and wellness coach. Same thing goes for nurses. You can be a registered nurse, and yes, trained with some motivational interviewing techniques, but you may not be a health and wellness trained coach. But the reverse could be true, right?
Yeah, and it's really important that health coaches stay within the scope of practice and are really doing the work that they were trained to do. Health coaches are not nudgers. They're not there to tell somebody to eat a certain thing or to adhere to a certain medication. They're there for more than that. They're there to understand the behavior of a person and why something didn't work for them or why something did, so they can set themselves up for success in the long run.
To wrap things up, I'm going to ask you both to comment on my favorite final question, which is, if you're to wake up tomorrow and find yourself 5 years in the future, what's one thing in healthcare that you would hope or expect to find has changed drastically?
Just one thing. So for me, it's hard, right? But for me, it would be preventive care over reactive care. I think if we get to that point as a society, I think we'll all see a lot of wonderful changes.
Yeah, maybe I'll just add, as I've been a long time proponent of digital and digital health, and I think it's advanced the industry, it's advanced our knowledge. But if we look at ultimately, if you think about IVR systems for a second, right, that were really being pushed heavily, and then ultimately, sometimes I just want to press 0 to talk to a real life person. And so I really hope that there's a workforce. It doesn't need to be, a health coaching, but a workforce. But we all need a person to lean on, right? And so I do hope that, that compassion, that empathy continues to be part of the healthcare system, and we don't write things off just to tech all the time.
Great. Well, thank you both. I appreciate your taking the time. Thank you for joining me.
Thank you, David. It's been a pleasure.
Pleasure as always. Let's see if I can make it 3 times.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.